Dr. Shreedhar Paudel. He's a medical doctor he has expertise in psychiatric and neurology. And he's a medical doctor in Boston, Massachusetts General Hospital. And he is also a founder of Health Foundation of Nepal. And before we begin our conversation, I would like to say all of our guests, if you're tuning in for our podcast today, please do subscribe and follow our Facebook, Instagram, and any other social media channel to get latest updates, any additional information, and additional videos. And this is going to be long conversation as usual. And I hope we have some interesting stories we can discuss with Dr. Paudel and see what our knowledge of psychiatry and new information what we can actually gain. So I would like to welcome Dr. Shreedhar Paudel.
Hi, Abhash. Thank you for having me. And hello, everyone, and namaste.
Thank you for coming to our podcast. When I found out about you, it really was intriguing in the sense of you have been involved in a lot of course, your medical career in the United States, and you do have your own work life in Massachusetts, but you have also been actively trying to help out Nepalese community and regarding Nepalese health. You had Health Foundation of Nepal, which is a non-profit organization which does a lot of work from what I could research on providing health services for a lot of community regarding especially focusing on mental health as well as other community services. So just getting to know you, it felt like you were someone who lived your life and who has come to United States to pursue your dream and your ambitions, but you have never gave up on Nepal, and you've always been trying to help out as much as you can. So could you just tell me about what your work is? Because it feels like such an important thing you're doing.
Okay, thank you, Avas. So, thank you for giving brief introduction and what I have been doing with my team in Nepal and also some of my work in United States of America. So here, overall, my work is I'm a psychiatrist, and my expertise is in community psychiatry and schizophrenia. These are the two specialties I have, meaning I work with the patients who have serious mental illness, we call schizophrenia or bipolar disorder. And if other psychiatrists cannot treat the condition, they will refer the patient to me. So that is my specialty. I have a special clinic for schizophrenia. And I also supervise the primary care doctor. So general internist primary care doctors who provide basic healthcare services, but they also have patients who have mental health issues. So they refer the cases to me, and I supervise them to manage the patients mainly for the mental health issues, not the general health issues. And besides that, the other big chunk of work I do, which is mostly volunteer, is the global mental health and global health projects. This is not Mass General project. This is not the project of Harvard Medical School where I work, but this is the project of Health Foundation Nepal, and it is recognized by Department of Psychiatry at Mass General Hospital. So that is also a big chunk of my work. In general, yeah, my clinical work, my volunteer service, these are the things I do.
Okay, that's awesome. You do have a lot of background in a lot of big institutions of like Harvard and other places. You have a really good background in education. So, can you give me a little bit history on? Let's start with your Health Foundation Nepal. So I want to go directly into this foundation.
Yeah.
So can you give a little bit information on what do this organization stand for and what are its goals?
Okay, that's very important. And when we talk about Health Foundation Nepal, probably it might be a good idea for talking about my overall background before
Yes.
I came to United States. So when I was doing my medical school in Nepal Institute of Medicine, Maharajganj, I had the dream to work in Nepal. That was my plan. I would become a doctor and work in Nepal. But I thought about coming to the United States, and I came here, and then I started new career in this country. But I could never forget about what I was dreaming to do back in Nepal, and that's how, while I was pursuing my master in public health (MPS) in New York City, I started creating or having the idea of some non-profit organization which would work basically for rural kind of people in rural Nepal and focus more on comprehensive primary healthcare services, which is community based. So that was the initial idea. And then I shared some of my thoughts to my colleagues and close friends, and everyone was really excited. That's really good. Let's do something. So that's how we thought of a Health Foundation Nepal. That was around mid 2012, and we had meetings and significant many discussions, and we came up with the idea. Okay, we will start a new non-profit called Health Foundation Nepal, and that will be registered both in the United States and also in Nepal. So that
So this
was
is,
the initial idea.
uh, it's been registered in United States as well.
Yes.
Okay, that's, and I did not know about that. And
Yeah, that was the first thing. We registered in New York, and then after a couple of months, we registered in Nepal. So this is non-profit organization, which is 501(c)(3), meaning tax exempt organization here, as well as in Nepal.
so it's basically multinational organization now. Okay, and yeah, go ahead with after you registered, you basically started up with a couple of your friends.
Mhm.
Is that what happened? And
Right.
how did that process begin?
So again, it is interesting. When we have new idea, we don't know what happens after that. We have no idea whether it will be accepted, whether we'll have more support from the people or not. But we were lucky to have many people, like many friends, who were coming from Nepal, settling in the United States, and they still had that passion to do something back in Nepal, right? So they cannot physically go back to Nepal. They are here, they are practicing here, they are working, they are studying, but can they do something back in Nepal while staying in the United States? That was the main idea, and many people thought this is a great idea. Let's do something. I want to be part of that. I want to volunteer. I want to give some money. And initially we thought, okay, if we have 100 people who can donate just $100 per year, not every month, because I was also a student at that time. I was not working. And then that would be 10,000 US dollars. That would be at that time roughly equivalent to 10 lakh Nepalese rupees. And that would be enough to start any project which is community based. And most of people in the rural Nepal, they would volunteer. And if we use our own network back in Nepal, we can do a lot of work. That was initial idea. And then we started contributing $100 per person, but we did not have 100 people to commit. So, and I wanted to wait until we have 100 people to start the project, but many people were really enthusiastic. And then they said, let's start now. We don't have to wait for like 100 people to start our project. Then within few months of registering the organization here and also in Nepal, we started our project. And we started project starting from Dang, where I come from. Initial idea was, can we do that from Jumla or Kalikot or Puri, Dhanusa, or any other districts where there are more challenges? But it was really difficult to kind of find out key person who will do all the groundwork in those districts. And we thought we should start from Dang, where we can start, and then Puri give good example. Then it can be translated into other districts. That's how
So,
we chose down.
yeah. So, what was the main beginning stage? For the beginning stage, what was your main objective?
So what we wanted to do, as I mentioned initially, community-based comprehensive primary healthcare. So meaning we wanted to talk to the people in the community and find out what is the real deal there, what is the main need. And for that, we had the report from the public health students of Institute of Medicine. somehow that was a coincidence. Two groups of students were sent to two village development committees, two big communities in Dang, and they had submitted the report, which is called Comprehensive kind of Community Health Project. So we reviewed that. That was a good kind of background for us. Then I went to those two communities, and I had meetings with the key stakeholders and the students and the teachers, and I assessed the community need. What are the main needs of the community in terms of the health? So I probably got top 10 list of the issues they have. And then we also reviewed the report from the students. And now we have the two things. One is what the community needs, other is what we have seen. So we call observed need and the felt need. So these are the two needs of the community.
Okay.
We observed something, people felt the need. And then based on that, what we can do at the moment and what is the most pertinent issue, that is called the real need. So we, based on those two needs, we found the real need, which was number one, significant malnutrition for the children, kuposan. And the other thing was the rural or kind of primary healthcare services. People have really difficult to find the doctors. They have to walk like hours and hours, or there are no physicians around. So that was the other demand or probably real need of the people. And then otherwise the maternal and child health program. These were the three programs we came up, and we started with the maternal malnutrition, childhood malnutrition project.
Okay, so I was guessing like because you were more you and your colleagues probably are more specialized in mental health, but your objective was basically the regular health itself in Nepalese rural villages were so in desperate
Right.
need. You started with those facility first,
Right.
and
Yeah, so I need to, sorry to interrupt, I need to probably specify. So at that time, in 2012 and 13, when we had the organization, I was not a psychiatrist. I was
okay,
just the MBBS general doctor and public health background, right? So
okay,
that's why that was my idea. I had no idea about the mental health at that time. So that was not in the need, and we could not do anything at that time on mental health. So the story, when we talk more, will come to the mental health, why we started this project.
okay. And the Health Foundation Nepal. So it started from you said as you said in Dang,
Yeah.
And from starting those two compared to now, what has changed and what has been additive, or how many people have been involved in it?
That's a great question. So if we run any projects, and especially the projects like what we run, which is we raise money by ourselves, we use our own pocket money and send that money to Nepal and run the project in very cost effective way. So so far in that specific malnutrition project for the children, we evaluated and treated more than 6,000 children. And among those, many children, they had significant, we call severe malnutrition. And we were trying to send them to the higher center for kind of more treatment, but nothing was available. And there was a rehab center for the children. We started sending them to the center of the town in Dan called Ghorai, but they were out of capacity. We were referring like
So
60,
yeah, so
70
can you give me
kids.
a little bit background on what the lifestyle or what the economic standard of Dang actually is for our audience? Because what we discuss is like we're going like really in malnutrition and
Mhm.
child healthcare, which is not much thought of by regular people. Is like oh,
Mhm.
like what was the lifestyle to
Right.
have that lower, like simple. Uh,
Mhm.
Caring of healthcare, providing healthcare was such a lack of it. Therefore,
Mhm.
like why you needed to actually do it. What was
Right.
Dang really like in those times?
Yeah, that's very important. Without probably having good background of the people in Dang, it might be difficult to understand all the things.
Yeah.
So Dang is really, that is the largest valley in Asia, and that is in the midwestern part of Nepal. And Dang is considered a really relatively developed but not well developed district if we compare with the nearby other districts like Jajarkot or Putan, Salyan, Rukum, Rolpa. These are the nearby districts. And besides the main town, city, Gorai and Tulsipur, most of the district, most of the communities are really rural and they do not have access to healthcare. They don't have good economic status as well. And where we started these projects, the two VDCs, the Village Development Committees at that time, most of the people in those two communities are from the Tharu communities or Chaudhary group. They are the indigenous people in Dang. And other major group is the other indigenous group, Gurung, Magar, those kind of group. And then Brahman, Kshetri, these are also kind of there, 15-20% of the total population. So Tharu group and other indigenous people are the majority. More than 50% of the people are in that group. So, and they are likely to have lower socioeconomic status. And then there are also the representative of the lower people like the term. I don't like to use the term, but we don't have the better term. The kind of untouchable or the lower caste people.
They this was
Dalit
what,
group, right?
yeah, this is what the society is like. Is there's like lower caste people and so on, which we like. These are just names that was used, which we don't like nowadays. Do they even call it nowadays like lower caste people, or is it the terminology has changed because
Dalit. They
Dalit?
still use the Dalit. Dalit is the term, and so
It's a little condescending word, but
mhm,
it's what the fact is. Like you have to categorize at least try even to try to help. You have to at least
right.
categorize it. It's
Mhm,
a weird term, but there are I guess there are different. Let's say if in the category of the elite, there are many classifications of people who have
mhm,
different job sector and who are
right.
in the economic standard, really low economic standard
Mhm,
of living, and you had a lot of people, say a little bit upper class or whatever, uh, all of those social classifications,
mhm,
still everybody was under the same economic hardship of not getting a healthcare
mhm,
as one should need.
right.
So Dang, which is probably on the really rural side, I would not
Mhm,
say extremely rural, but pretty rural side of Nepal, they probably don't have regular what we consider regular healthcare of immunization, vaccination, as well as any disease like hospital clinics. These are all rare and important commodity. They, I would say, luxury that they barely get to afford, and that's what you are trying to improve on.
mhm. Yeah, so this was again in more rural, more remote areas. There are more challenges. Towards the center, nearby the Gorai and Tulsipur cities, there are more kind of services available. So coming to the point we were discussing, so significant number of people are from lower socioeconomic status. So meaning there is high risk of having malnutrition. And when we were figuring out and classifying the children in terms of the severity of malnutrition, uh, most people who had the severe malnutrition, they were from either Dalit group or from the Chaudhary group. And then roughly we treated more than 300 children with our home-based nutritional rehabilitation program. We had to design the new innovative projects because nobody in Nepal was able to kind of provide those services to the children, and we didn't want to wait until they wait for like 6 months or a year or die before they get the treatment. That's why we started home-based treatment for the children. That was the big and milestone project of Health Foundation Nepal, and then
So the
after that we
doctors.
started going to the other projects slowly, like the rural health clinic for more primary healthcare services, and then mental health.
So, as you said, home-based system where
Right.
the doctors or the healthcare providers goes to the home, treats the
Mhm.
family and figures out what was the problem and give them solutions
Mhm.
or medications. Was it all free or was it certain specific charges? How did you decide how much you can provide? Because everything costs.
Right. That's really important point, and I think it's very good that you brought up that point. We do not charge anything for the patients. Everything is free. and we are raising money from here and sending it to Nepal, and we provide everything free of service. And then while you were kind of mentioning about the home base, so our team will go to the communities and visit the children wherever they are and teach the family and parents how to prepare more nutritious food and make sure they provide appropriate nutrition. And at the same time, monitor the children. And in our program, whenever whoever is enrolled in the program, nutritional rehabilitation program, which is the home-based program, then they will get the supplementation of nutrition supplementation. Meaning, we started with the milk and superfloor, the sarbat tampito, and then later we found that actually egg might be better than the milk, and we started supplying eggs and the superfloor sarbat tampito. That's how we treat the children with severe malnutrition, and also at the same time do more community awareness program to make sure parents and the community understand the value of the nutrition.
Okay. So I've known there are many organizations working similar to what you're doing
Mhm.
regarding community health and village development committees. A lot of VDCs work in conjunction with a lot of health providers. There are
Mhm.
some government-based, mostly non-NGOs. And have you had chance to work with others to collaborate and to go in the little bit mass scale? I believe now how many like how well is your I guess the program doing right now?
So that's very important point. So 2.1 is the collaboration part. Other
Yeah.
is the kind of effectiveness or what's happening after our intervention. Two issues. One first thing is the collaboration. We collaborate with the local government or the health post or the health centers in those communities, and we also use the FCSVs, the volunteers who work in the rural communities, and we did not work with any specific NGOs working in those areas. And it's just very interesting whenever we talk about, okay, so in Nepal, there's really good system, health system, and there are so many NGOs working for the malnutrition. We have USAID and UN projects and so many other projects. Like they're working really hard, yes, but where they are working, I have no idea. They're working somewhere in the seminars or the trainings, and they spend most of the money in those areas. And
Yeah.
the real people, they don't actually get the services they need. And we
It's
saw
always
that.
the administrative budget always surpasses. That's one of the major criticism of Red Cross and so on is all of the filtration of like administrative costs, seminars, and
Mhm.
all of those takes away such a huge amount of money that the final money or final budget that's been allocated for the local service is like only a fraction of what it was
Right. Yeah.
intended to be, and that gives a bad rep for the people working, the
Mhm.
people donating, and uh, that's a huge loss for everybody.
Right. Yeah.
So, and when you go and work in the community yourself and you organize events to where you people go, your employee, all your healthcare providers go there and they plan out the budget and they plan out everything. It kind of helps to the effectiveness goes way up higher, I
Mhm.
think.
Right. Yeah. Yeah, that's important, and that's how we are able to provide healthcare services in very low cost and very efficient, and outcomes are great. And we do not believe more on going to the media and saying, hey, by the way, yeah, we are doing this kind of work, and just kind of show that in the news. That is not what we do. We just want to go and work, and the people know whatever we are doing. We don't need to come to the big news media or anything. And we have been serving people, many thousands of people since 2013 and 14. And most of the news journalists, when I was there for other programs recently, they were kind of asking me, why you never come to us? We didn't know about your programs. They were going on for last like 5 6 years. I said, you should come and figure out what's going on in the community. We should not come to you in the center and report that these are the things we have been doing. So again, we don't kind of believe in those things like just come to the media, don't work, focus more on other things. So to come to the main question you had, so when we started to work in that community, those communities, the rate of malnutrition was about 35 to 36%. So
That's huge. That's
yeah,
extremely huge.
yeah. So almost one third of the children under 5 age, they had either mild, moderate, or severe form of malnutrition. And then
And
after
yeah, those
2 years of
malnutrition
work,
turns
yeah,
up to the increases the death rate. It's not a regular malnutrition, as you said. There's different level of malnutrition, but
mhm,
the child mortality rate is maximum. One of the major component of child mortality rate is due to malnutrition,
right,
especially
yeah,
in a country like Nepal.
right, yeah. So that's why if we address the severe malnutrition, we can save the life of children. And that's why we wanted to work with the vulnerable children. These are the future generation who will probably change the world, not only Nepal, right? So that's why we wanted to focus on the children. And then now, if you go and do the survey in our communities, the rate is below 10%. So that is very, very rare in Nepal. But again, we are just trying to kind of discuss these outcomes with the government agencies so that they can also kind of work with similar model and come up with the idea. The INGOs and government, they are spending a lot of money, but what they are getting outcome, I have no idea. And I'm not blaming anyone. Everyone is doing their part, but there is a way to do more community-based programs and home-based intervention, which can save lives and is very cost-effective and it works.
And how has your program expanded after that?
So initially we started with like just few wards of the communities, and then one VDC has population of 16,000 to 20,000. So we developed with the two VDCs, and then we extended to the other adjacent VDCs. So we are working on two full VDCs plus a part of other two VDCs. So we have not gone beyond those four VDCs so far. Um, and the cost probably that might be important for the audience to know if anyone is interested. What is the cost? How much is the cost of this home-based nutritional rehabilitation program for children? And it's less than that now, but it was roughly 40 cents per child per day. That was the cost of the treatment for severe malnutrition. And probably anyone can come and say, okay, we can do better than that. That we will accept that. But 40 cents in $1, we can treat more than children who have severe malnutrition for whole one day. So that includes the intervention with the supplementation of the food and also cost of the healthcare worker who go and visit the community.
Yeah, I'm gonna have the information for people to donate at the description below. But can you also just give the organization where people can donate right now as well?
Yes, so anyone who wants to donate, they can go to healthfoundationnepal.org, and we have the kind of button to click and donate. You can donate anytime. And besides that, anyone, if they have any interest, they can also send check to the address, which can be found in our website. Again, healthfoundationnepal.org, or they can contact either me, or if we find a type Health Foundation Nepal in Facebook, we can find all the information people need.
Awesome. Yeah, and so let's focus on. I want to shift the conversation to little towards the mental health. That's what that intrigued me about your organization, the Health Foundation Nepal. So after hearing from the regular health, general health, for especially focused on the children. So you said we also the organization also focused itself on providing mental health care and
Right.
other services towards mental health. So I want to have a little bit more deep conversation in the mental health side. And as you being a psychiatrist and you're focusing most of your advanced career in this side, so how is the mental health treatment, or should I say, how has the services for mental health or whatever the stigmatism or everything regarding that comes with mental
Right.
health specifically been in Nepal for your organization to start any kind of program to
Right.
support the people?
Yeah, that's very, very important question and very significant issue in Nepal and also here in the States, right? There is severe stigma of getting care for mental health. all over the world, more in the developing countries like Nepal. And it's not only stigma, it is not available to the people. Even if it is available to the big cities like Kathmandu, um, it is not accessible to most people. So, so let's go to probably a little bit of history why we started, or I gave strong emphasis on mental health through our organization. It was around 2013. I was still in the training, so towards the end of my residency training at that time, and I saw many news. I read national dailies of Nepal every day, every morning before I go for CNN or other news here in the States. So I saw this like, ongoing news about, okay, this person is kind of tied with the rope or with the metal chain, and this family is trying to manage this person at
Oh
home
yeah.
because this person has severe mental illness.
So
And
so let's give a little bit background.
so,
The perception of mental health, or perception of someone suffering a mental health. How would anybody know? So we have always heard news of somebody, as you said, being tied up. It's like once somebody goes into a severe mental health issue, the family, what do they do? They have no option. They have if there's a physical altercation, or physically the patient is in, I would say the person is in a little bit chaotic mode. What do they do? In states too, you have a little bit medically bonded way
right.
of tying them up.
Mm,
But back home, you're just like, okay, you have to tie them up, rope them up, and
right.
it's all such a, it's weird. It's almost like you're treating them as a criminal, but
Right.
you have no other option to
Right.
how to treat them. The
Mm,
family are in despair. The community are like, oh, someone gone mad. That's the terminology. Is
mm,
like the physically insane or mentally insane, and no solution. Like, who takes care of the person? And then they are sent into uh, I guess the general terminology is mad hospital, like
psychiatric hospital.
psychiatric hospital. The general, I don't even know Nepal has good psychiatric hospital in that sense, but basically they are sent like, okay, your life is over now. You are basically a prisoner of your mental health, and I guess the mental condition is not going to improve from that onwards, unless it's like the one of those rare hospital that actually treats them okay. But it's almost a descending. I guess the life would always go below than what it
Mm.
was. There's no way of progress. And how is that? How could that ever change? And how is your organization, in your sense, like how have you evaluated what can be changed?
I think I'll probably start from the middle. Very important point, Avas. So if someone has mental health issues or mental illnesses, that does not, I wanted to emphasize, that does not mean that it cannot be cured or it cannot get better in lifetime. That is wrong. It can be. People can have normal life with even severe mental health issues, not the general mental health issues. I'll probably come to that point because that might be important for the audience. So with that, let's go to the what is mental health? What do we know about it and what it is? So if we talk about mental illnesses, so that is anything starting from some simple like stress, anxiety, feeling nervous, worried about what might happen tomorrow, versus with that worry and nervousness, not being able to stay still and thinking too much, not being able to stop the mind, and having heart is pounding fast and breathing a little bit faster, trembling, all those things. All those things can happen. That is simple anxiety stress. There are varieties of the categories within that, the anxiety. Other thing is the mood disorder, meaning people feel sad, hopeless, helpless, no motivation, no desire to be alive, and some people might die because of suicide. Versus the opposite of the feeling sad, meaning super happy and too much energetic and being impulsive and doing inappropriate things, we call manic symptoms or bipolar illnesses. These are the kind of mood disorders. So it's pretty easy to treat these conditions like the mood disorder or the anxiety disorder, and people can function without much difficulties unless they don't get treatment, or the condition is severe enough, then there will be significant difficulties. And bipolar disorder manic phase might be more challenging to treat, or that can disrupt people's life more than the depression. The other category, big category, which is probably more the sense people have the idea about mental illness, is the psychotic group or the thought disorder. So people call it schizophrenia. In Nepal, people call it pagal or baulaha. So that is the term used for those specific group of people, not for people who have other mental health issues. So it is typical for that group. In US, we call schizophrenia spectrum disorder. That is the thought disorder group. It can come to schizophrenia versus brief psychotic disorder versus any kind of issues where people go a little bit far beyond their reality, and they have difficulty to figure out what's right and what's wrong, and they might hear the things, the sound that's not there, they might see the things or people, animal, which is not actually there. They might have interesting and odd and bizarre behavior which is kind of odd to people. So that is the typical psychotic group or the people with schizophrenia. So the pagal group, or the term used for pagal or bola, is for those group and also for the manic phase of the bipolar disorder. So we don't need to get into the details, but these are in general categories for mental health issues. And and again, when we talk about mental health, most of it comes around anxiety and depression, because roughly 80 to 90% of all mental health issues are revolve around anxiety and depression. Very few cases have that manic phase of the bipolar and the psychosis or the schizophrenia.
Yeah, almost, at least in Nepal, when we were, I guess when I was growing up, and still probably is there, is you only think of mental health when you go into that deep level of schizophrenia or
Right.
any other like severe cases. But if it's depression, anxiety, and those things comparatively are new way of seeing things, which are always prevalent. It had always been prevalent, but they never take it as, oh, there's some kind of it needs a mental care,
Right.
it's a kind of mental health problem, and it needs some kind of care, and that is a new terminology, I guess, a new way of looking at another luxury for people to take care of, which I barely think there have been any discussion. There probably has been a lot of discussion now, but it was not so. And the anxiety and depression here in the United States is extremely high. And it has been a lot of issues for a lot of suicide and other mental stress. Your work life activity, your regular life activity it has impact in everything. And in Nepal too, it does have impact, but it never was a term of discussion as a mental health. So for a lot of people who, I guess, let's go a little bit different route. For people who are suffering from those in the lower spectrum of, I guess, in depression or those anxiety route, and Nepal, especially in Nepal, how has things been changed? Or have your organization or any other that you know of had been working to help out in those cases?
Yes. So nowadays, like, if we compare 20 years ago or 10 years ago versus now, things have changed. And the country did not have the mental health policy. So we have that policy as of like 2017 or 18, even though it was developed long time ago. And the government is also kind of thinking this is also essential health care, so we should do something. And some non-profit organizations are also trying to they are trying to work. And so things are changing a little bit, but still it's a significant. So I will give you one example, which is when I started thinking about the mental health project in roughly 2017. Initially, I thought about more serious mental health issues, how I can provide or create a system where people with serious mental illness who are kind of living on the street or tied up inside the family house can come to the center, get the treatment, not only the medication, but also the rehabilitative care and skill, so that they can go back to the community and have like normal life. That was my envision. That's how I started the project in 2017. And then I realized, by the way, I'm just looking at the top tier. So most people who have mental health issues, they have depression, anxiety, and PTSD, and substance use disorder, and all those things. what am I going to do with those people, right? And then I thought about the Dang district, which is relatively kind of, as we talked about before, people have some resource in some part of the district, but not everyone. And there was not even a single psychiatrist in the whole district. The population at that time was a little more than 700,000.
And that gives you an example of if somebody has a problem, say severe, there's no solution. They're just in chaos.
Not even for like simple anxiety, depression. There
Yeah.
is no psychologist, no counselor in the whole district, no psychiatrist in the whole district. What should they do? As you mentioned earlier, if someone has anxiety, depression, people will say, you should be strong, don't be weak, don't cry, move on. But if we look into the data, many people who have depression, they die because of suicide. Significant number. And and you were kind of bringing that, comparing that to the states here. So roughly, depression is top two, like second leading cause of disability in the whole world now.
That's
It can
insane.
cause, it can disable people, even though it will not kill everyone, but with 10% of the people who have depression will die because of suicide.
And
And
that's
that
still a
also
lot
includes
number.
other medical issues,
Yeah.
but that's significant, right? So that's why we need to address those anxiety and depression. That's how I started envisioning other project, which was to integrate mental health in the primary healthcare services. That's very important. Nepal has very good system of the healthcare infrastructure, even though we don't have the good resources and the services, but we have the system, which is each VDC has either health post or sub-health post. It's changing, the name is changing now because of the federal model, but still they have the health center, which has basic primary healthcare services, which is supposed to have at least, right? And if we can integrate mental health in those tiny, small health centers in the rural communities of Nepal, then we don't have to go to see a psychiatrist or psychologist to treat anxiety and depression, right? We have to go to see a psychiatrist for more severe issues, but not for simple mental health issues. That's why we started integrating mental health in our own clinic. We run primary healthcare clinic, all services are free, and we started integrating the mental health starting in 2018. So anyone who comes to our clinic, they will be screened for depression, anxiety, and alcohol use disorder. And if they have any problem, we have the treatment protocol, and we will start treatment right there. They don't have to go to Kathmandu, the only mental health hospital in the whole country, Patan Hospital in Lagankhel, and they don't need to go to the teaching hospitals where they can get some mental health care.
Okay. So, just talking about the anxiety and depression, even for people back home in Nepal or right here in the United States. So I've always seen in Facebook posts of people, there are different various helping groups in Facebook,
Right.
where people express like some problem they have and try to get the Nepalese community or any community to give them suggestions. And unbeknowingly, there are more than few cases of mental health issues. A lot of them have anxiety and depression, especially for students who come to the United States and they have an economic problem, economic hardship, or relationship hardship. A lot of things comes into factor. But the thing is, everything costs money. So in states, especially for international students or just for anybody who is in the states, treating going for any medical treatment or psychological or therapy cost a lot of it's a lot of expenditure and a lot of insurance don't cover it, and there's all of those factors in. So I've been hearing a lot of those kind of questions is like, where should I go, who should I talk to, what can I expect? And anytime people come have those I guess they express their problem, they go with alias like, oh, my friend or my friend's brother. They don't come out as I have a problem, and a lot of people are coming out too, but it's always taken in the sense of a little bit being a little bit scared. So there's always a stigma. It's like if he or she had a mental, I guess some kind of problem or some kind of depression or so on, it's gonna be there forever. People are gonna know. A long time ago she had a depression. It's gonna stick out as something bad, which is of course not true. It's like any other disease. It gets treated.
Right.
But a lot of people are still having that feel of it might stick with me forever. I don't want to come out and say to others, and that's why a lot of health issues is more private.
Right.
But they are stuck in such a beginning place. It's like, I don't know what to do. Who should I consult? Should I go to therapy, or should I go to, if there's a severe, where should I go? How would you suggest for, I want you to break down into two, for Nepal and for United States, the beginning process of first determining yourself that, okay, to acknowledge you might have a problem, and what should I do next, and what can be expected, the cost and other things. Just give out as much as you can.
Okay, good. So that's a great point, more kind of practical thing for the people. So in terms of Nepal, we can go to Nepal again later, but in general, in Nepal, it's very difficult to find a psychiatrist and psychologist. Most of them, 90%, are within Kathmandu Valley. Just 10% of them are outside Kathmandu, mainly only in the medical schools. So that I was giving the example, not even a single psychiatrist in whole district, and also nearby district, like all 5 nearby districts of the Dang, right? So that means there is no mental health care at all in Nepal as of now. So 80 to 90% treatment gap, that's what it is in Nepal. 90% people who have mental health issues, they do not have access to the mental health care. So what we should do is, if family sees someone is behaving kind of differently, not talking to anyone, keeping to themselves, or really nervous, restless, or behaving kind of bizarre, then we should probably talk to that person and then try to bring that person to the hospital or nearby doctors. And then the doctors would figure out this is probably mental health issues, and they will refer the person to wherever it needs to be. This is pretty simple because there is no service available in Nepal. So second thing is in this in the United States of America. So what basic thing is, if anyone has primary care doctors, that might be the first thing to do, because these days people are kind of integrating mental health in most of the primary healthcare centers, or at least they have the connection to the psychiatrist or the counselors. So that's why beginning point, if anyone has any significant stress, anxiety, depression, or more severe mental health issues, they should contact PCP as the number one. If they do not have PCP, they don't want to talk to PCP about that, there is the option. The other route is, we can Google, and psychology today is probably the best thing to look for any local therapist and psychologist. And we can Google that and then find out who is nearby our town. And then there is the contact number, there is the email, we can contact that therapist and we can get them, right? That is the other way. And then if there is more severe issues, we can also contact directly the psychiatrist. And most of the big hospitals, they have some form of psychiatric care, and they might have the psychiatrist in the states. So it might not be that difficult to find a psychiatrist, but the caveat is the insurance piece. And still, it's so odd, even in the United States, there's disparity between the general medical care and the mental health care. And recently there are like good movement, but still some of the insurances, they do not cover the mental health. They have to have like more extra payment to get the services or coverage for the mental health care. So hopefully it will be easier for any insurance, people with any insurance to get the mental health care. That is the hope with the new upcoming government. So basically, if someone has simple anxiety, depression, stress in life, they can find a therapist. And there are like different categories of the therapist. So highest tier is the psychologist with PhD or PsyD degree. And then the second tier is the social workers who have special mental health training. That is called licensed independent mental health, LICSW, independent clinical social worker. So LICSWs, these are probably the second in the tier. Then there are other counselors as well. We can find any counselors, and they can be the real resource for us to figure out if we need to see a psychiatrist or not. And they would know if it will be taken care of by the therapy alone versus someone needs to take the medication. Because not everyone needs medication. Medication is not for all mild to moderate cases. It is mostly for the moderate to severe cases of depression, anxiety, or serious mental health issues.
Okay, that's yeah. There's still a lot of getting used to in that phase of like just getting used to connecting to a doctor or any to beginning counselor to get started. That phase is just a lot of people can't take that first step. They know they have some kind of problem. They know they have depression. They try to wear it out, and it kind of goes. Sometimes it goes even. Sometimes it goes for the better, but a lot of times it goes into even severe depression,
Right.
and that's a lot of concerning stage for a lot of people. And the depression and as you just said, like we need to have a better way of getting those in the government or the private insurance side. It needs to better cover those kind of mental health thing. But if you go someone who is, are there options to pay cash and other ways of payment which are not so stringent about for the especially for the students who might want to take some who might be able to pay some but they might not be able to exceed something as a severe case, but they can get started. Do you know of those places in the United States where you can at least get started?
So that's important point, and probably most of the universities in the United States of America, they are required to have these um, counselors on campus. So that might be the first thing for the students. They don't have to actually
Yeah,
go
go for the
outside.
counselor. Use your whatever you pay your insurance. It covers for the counselor. So go for it. Yeah, don't feel
Right.
shy. Would be a
Yeah.
good suggestion.
But
And
if that's not available, if that's not appropriate, if we need to find someone outside, then and if the insurance does not cover, then we can pay out of the pocket. And there are actually many counselors and private psychiatrists working in the private practice. The downside is that they are very expensive.
it
So
is.
we might have to pay, like, depending on where you are, $150, $200 to $300 for a therapist for one session versus $300 to $500 for a psychiatrist for one session. So it can be very expensive, but there are options, and we can find those options online. That is easy in this country. We can find anything online. They
So
have the website,
so
but it can be
beside
very expensive.
yeah, beside going to a therapist, say, how can a family or friends of people who knows somebody is going through that process, how can they involve themselves in their lives trying to help them? How, I guess those will be the primary, the person,
Right.
people who would be generally affected beside the person who is feeling it itself, him, herself, would be the people around them. How
Right. Yeah.
can they try to help the person?
Yeah, that's the key. And at times, the person who has been suffering might not have motivation or energy, enthusiasm to go and seek care, versus they might be out of the touch of the reality and they don't know what's going on to them. So that's why the family and the friends, that's very key. So again, I get call and emails like every day from the Nepalese people or the relatives in this country. Like, what should I do? My friend, my brother, my sister, my mom, my dad has this problem, and so I always give this kind of free advice and support to the people. But that's not enough, right? So that's why if we find someone around us has potential mental health issues, then if we can bring that person to the body, again, as I said earlier, primary care doctor would be the best thing. And most of the PCP offices now, they have the provision that anyone, whoever goes there, they will screen for the depression and anxiety. There's like PSU2, meaning just the two questions they will ask screening. And if someone says, I don't feel good, or I don't have any motivation, they will actually, that will trigger the system, and the doctor will actually ask more about that question. They might figure out, and
Oh,
hey,
those
by
are
the
the
way,
questions that
you need
they
to go.
ask before the examination begins. Are
Right.
like,
Yeah.
do you
Yeah.
have this or that? I
Right.
guess you really have to be honest about your answers. And
Right.
those triggers the automatic system.
Right. Yeah.
Okay.
And that's the key, to be really honest. If you don't feel really kind of happy, feel sad, don't have any motivation, if you can't feel happy, talk to the primary care doctors. Wherever you go, it can be PA versus nurse practitioner versus the doctor, talk to them about that, or at least if you can talk in the screening question, write about those two kind of questions, and then you will get help. And again, there are many health centers which have tied up with these counselors, and it might be easier to get the counselor that
Okay.
way.
And that's really interesting and important things as well. So I want to go towards a little severe. So for the people who are suffering, or for the people around them who are suffering from the severe uh, mental
Mm.
problems or mental health issues. So what actually is the treatment? So for example, if a family has someone who is suffering from severe schizophrenia or
Mm.
mental disorder of any sort of things, and acting in a way that's probably not socially or family wise a little bit
Mm.
impactful, and they
Right.
really want to have them treated as in a severe medical
Mm.
I guess mental health condition.
Right.
They go to hospital, they get sent to I guess a psychiatric ward or in those can you explain to me what are the process for the severe
Mm.
cases and what actually
Mhm.
are the treatments that are currently
Mhm.
in the market right now?
Okay. Yeah, that's very important, and many people don't have like idea about how it works, and that's why if anyone wants to learn more about that process, you can watch this. So if someone has more serious mental health issues, the first thing would be they will see a psychiatrist. Any system will trigger if you go to see a counselor or a primary care doctor. If they feel this person has more serious health issues, they will refer you to a psychiatrist. That is the number one. Then within the psychiatrist, depending on if the psychiatrist feels comfortable to manage that issues, they will pursue that. If they don't feel comfortable, they will actually refer you to the specialist. Like for example, in my case, if my colleagues at Mass General Hospital, all the psychiatrists, if they find someone who has schizophrenia and they start treating but it doesn't work, the medicine is not helping, then they will actually send those people to me or one of my other colleagues in the clinic, and then we will take care of that. So there is the way you can get specialized care, super specialized care within the serious mental health issues. But the starting point is the outpatient care. So you will go in the outpatient setting, office setting, meet psychiatric doctor, and they will recommend the treatment. It can be medication plus therapy plus rehabilitation services versus just the medication versus just the therapy. That might be, it depends on the individual's need at that time. And then if the condition is severe enough and acute, right? Acute meaning if someone is really in danger for themselves or for others because of the mental health issues, that is called acute mental health condition. Then they will be sent to the emergency, nearby emergency, and then emergency, not the psychiatric hospital, regular emergency, and most of them have the psychiatric help, and they will be evaluated for acute need for the mental health care. And if they feel there is acute need, the person is in danger, or the family or the people around are in danger because of that person's mental health condition, then that person will be admitted to the psychiatric ward, or where we can get inpatient mental health care. So that is the process. So outpatient services, and then the
Yeah.
emergency evaluation, and the inpatient services.
So a lot of times it's the conversation kind of doesn't want to go deep, but I want to go a little bit deeper on
Sure.
what actually happens in psychiatric ward, because
Mhm.
I guess a lot of families might have someone in those kind of sessions and they
Mhm.
have no idea,
Right.
because I guess even my own family, I guess a family member had some issues with
Mm.
uh, I guess psychiatric behavioral change ward, but they were physically abusive.
Mm.
So and later was found out and everything was dismantled. But
Right.
those are not always the perfect place, and a lot of
Mhm.
the I guess agency or a lot of the health providers they try to bring out the result, but the way of
Mhm.
treatment is not ethical. So what can you explain to me? What are the different ways, or what are the different criteria that happens, or medical treatment strategies that is implemented, which seems which kind of touches in the borderline of being ethical or not, but there are no other options. Even we hear about electric therapy treatment, and those we always see in the movies or so on those kind of places. But what are the effective benefits of those, or what are the different strategies with the new technologies that's coming up?
Yeah, you are bringing up very important questions, and we are getting more inside deep of the mental health care. But I wanted to probably clarify two important things you mentioned. The first thing is about the ECT. That is more fascinating. So the electric shock treatment is called ECT, right? Electroconvulsive therapy. That is the most effective treatment ever in the earth for severe mental health issues, whether it's depression, severe depression, where people are trying to kind of die by suicide, or if they are not eating, they are not doing anything we call catatonic, then that is the treatment.
So
You should get it,
what is the
right?
reasoning or what is the functioning of that treatment? If you have to explain.
I'll come to that point,
Yeah,
right?
that's
And if someone has severe psychosis, really they are acutely psychotic, they are hallucinating, seeing things, hearing things, and they have like bizarre behaviors, then in those conditions ECT is the best treatment. And again, if people watch movies about the ECT, there was the old days. There is not such thing like the electric shock therapy which we see in the movies. That's wrong. Okay? That's not what happens in the ECT treatment. I am certified to the ECT. I did ECT to many of the patients. So ECT is pretty simple and it works, right? And but the downside is that it is not available. It's very expensive. And the ECT is pretty simple things. We give the electric energy to the brain, and that the brain gets seizure, meaning it will really give shock. That's why it's called shock,
so
right? It is kind
the
of
firing.
rebooting the brain, right?
Yeah, so the
Rebooting the brain.
neurons that have been blocked, probably you're trying to trigger the neuron firings.
Yeah, so it creates the kind of all kinds of firing of the neurons in all over the brain, not only one part, right?
Okay.
Again, I don't want to get into the details, but in general, it reboots the brain. So if computer is not working, you reboot, and if there is like any virus in your system in the computer, you have to find the antivirus. It's like that. ECT is very effective, very safe. It works. It is not unethical. People will be given medication, they will be sleeping, and they will get that treatment. It is roughly 30 seconds treatment. Okay, even though we need preparation, but the total treatment is just 30 seconds, and then people will feel better. So if someone can get the ECT for severe depression or severe psychosis, get it. Don't worry about it. But the way it works is you will get the training beforehand, you will see the video how it works, and then you can do. There are like different models, and the new model where we give like unilateral ECT, so that does not have significant memory issues, and that is one of the side effects from the ECT, and it works. So again, ECT is really great treatment, but not available, very expensive in this country. Interestingly, if you look the data, the people who are getting ECT, they are rich, they are high professionals like doctors, engineers, lawyers. These are the people who are getting the ECT, and they are functional, they are doing really well. But the bottom group who don't have the money, who don't know all the resources, they are not getting the treatment, which is really effective. I want to kind of clarify that is really good treatment if we can get it. In Nepal, it's a little bit different, but still they are trying to do the same similar kind of ECT we do here. So it's kind of we are making progress in Nepal as well. Then the other thing is about the treatment in inpatient care, if it is ethical or people are abused in the mental health ward, right? So again, I don't know, like there might be certain hospitals where the staffs might not be well equipped, they might not be kind of well trained, and people might have difficulties. But in general, if we look into the data, more than 90% of the time, you will get the care which will be kind of really surprised if you go to the mental health ward. I don't want to talk about the Lagan Kale hospital. I don't know much about that, okay, in Nepal. But here in the country, in the States, if you go to the mental health ward, you will come out saying, oh my God, I never thought it's so good care. So most people have that feeling. So what happens is that you will go and stay in the hospital, and you will have your own bed. Sometimes people have to share the bed, like two people in one room. There might be just one person per room, and you will meet psychiatrists, doctors every day, and meet a nurse every day, and counselor, psychologist, or the therapist every day. There'll be groups teaching you the skills, how to manage the anxiety, depression, even the psychosis, how to get through these difficult symptoms. So you will learn the skills. This is intensive. So that's why you will get really good care. But caveat is that if someone has psychosis or more serious health issues, they don't believe that they have any problem, and the family is forcing them to get the care. Or, as I was using the term initially, if someone is acutely in danger because of the mental health issues, the doctors might have to admit them forcefully. We call involuntary treatment, right? In that case, it can be challenging, and they might try to elope. In that case, we have to restrain, because if they go outside, their life might be in danger. And we typically use the chemical restraint, meaning give the medication so that they will be calm, they will not be hyperactive, and they will be okay after some time. Or if that doesn't work, and if that's not available right away, and is like really danger to the patient or the staff, then they can do the mechanical restraining. They might tie up in the like special setting, but with the soft clothes. So, and that can happen. It's very rare that happens. But if that happens, it's very painful to the doctors or the nurses or whoever does that. And we have to report that to the government, federal government, if that happens. It's a pretty severe thing in America. Like we take everything pretty seriously, right? So that's why if you have your family, your friends, they have severe mental health issues, they are suicidal, and they are really hyperactive, they can't stay still, they can't sleep, they can function well, it's a good idea for them to get inpatient mental health care. It's really good experience.
And with you regarding your organization, Foundation Nepal, and nowadays, have like with the regarding to mental health itself, what has been implemented, or as you said, we talked about all of these concern, all of these strategy or treatments. Has anything in those sort been implemented or in plans to be implemented for
It's a
your
great,
foundation?
point. So thank you for bringing us back to Nepal, right? So what we are implementing now is the first thing we talked a little earlier was the integration of mental health, basic mental health in the primary healthcare setting or the primary healthcare centers. So we have that in our own health center. Plus, we have like 4 other government health centers, not the hospitals, primary healthcare centers, where our counselors go and provide the care. So we have try to integrate mental health into other 4 government health centers as well. So the other big project, another milestone of Health Foundation Nepal is the we call Smile Mothers campaign. That was the term I thought and I coined.
That's
And
beautiful.
yeah, and that is for maternal mental health program. So while we were starting this discussion, we talked about the children, right? Vulnerable children. Now we are talking about the vulnerable mothers, pregnant mothers, postpartum mothers, meaning mothers after they give birth to the baby. So within a year period after giving the birth, they are in high risk situation for depression and anxiety, even more serious mental health issues. And the pregnancy, during that time, they are also in really high stressful situation. There is high risk of having anxiety and depression. So we were to focus on those mothers who are either pregnant or postpartum. That's why we started this Smile Mothers campaign, and I designed the project with the help of my friends. And then the cost of treating one mother for whole 1 year was, you can guess, $10
Wait, what? $10?
for whole 1 year
1 year.
treatment for a mother. So that's why I started this campaign. We raise money again. I want to make sure I deliver this message. Resource is never a problem. We have enormous resource in the world, right? We need to learn how to tap the resource. So I didn't have to do anything. I just coined the term. I designed the program. I said, okay, who wants to contribute for this Smile Mothers campaign? So if anyone donates $100, they will treat 10 mothers for whole 1 year. If someone donates 1,000, they will treat 100 mothers. That's up to them. So we were able to treat so far more than 900 mothers who are pregnant or postpartum. So that is the really big deal. And I have seen the pictures and videos of the mothers who were really severely depressed, not able to talk to anyone, and were pregnant. And then now there's no one to support in the family, and our team helped and supported. They got the baby is fine, mother is fine, still doing the therapy, still taking the medication, perfectly normal now. So that gives the sense of pleasure and joy. That's why I do all this kind of work. And I think everyone who works in those kind of humanitarian work, we get the satisfaction by seeing the outcome. So
Yeah, this is. We really appreciate your work. That this is anybody trying to do any community work is has to be. We're really thankful for your work and all of those people involved with your organization and anybody helping all those mothers. That's amazing job. That's that's a godly work. And I want to bring our conversation on. Expectation of I guess a lot of the number of expected mental health problem is gonna be increased due to corona.
Right.
Yeah. So I want your opinion, or like I just want you to give some I guess information on, because there are a lot of people are losing their job due to corona. A lot of people are being affected by it. Somebody in the family might have been dead. The case of psychological distress and the mental health issues is rapidly increasing, and it's expected to increase a lot because the economic crisis is beginning to take its toll. A lot of people losing their job, businesses is taking their toll. So what do you think is unexpected consequence of this virus and its socioeconomic impact?
That's a really important question and very relevant at this time. When we started having big impact of the COVID-19 in America, there was roughly probably March, April. We had significant cases around the March, April. And then we started kind of figuring out what's going on. And we had no idea initially what happens after COVID-19. People might die, they might have respiratory issues, they might not have enough oxygen in their system, but people didn't think about the mental health part. But the data showed that people have significant issues, not only the patients who are suffering and who need to be intubated and be in the ICU intensive care unit setting in the hospital, and their families, but also the doctors and the nurses and other healthcare professionals who are working directly with the patients. And it was enormous stress. And then that created significant difficulty with the anxiety symptoms, depressive symptoms, and also sleep issues. Like people were unable to sleep. These are the three big things initially, and that's still the significant thing. And we'll see more consequences down the road. And overall consequences would be higher stress, higher anxiety, higher mood disorders like the depression, and potentially PTSD, post-traumatic stress disorder, that happens with any significant exposure to significant trauma. So that's increasing in the world. Wherever we go, we see the data that's happening. And we like after seeing all those kind of surges in the mental health issues, we started here with the help of other psychiatrists and counselors who are from Nepal and currently in America. We started a group called COVID Stress Management Help Desk. That was end of April. And then we started running different awareness campaigns, and we conducted multiple webinars focusing on the mental health impacts of COVID-19, how to manage that. So anyone can find those in Facebook. I didn't create the YouTube channel at that time, but we had 11 different webinars seen by thousands of people around the world. And that has all the information that we need, what can happen because of the COVID-19 and what we should do, how to manage that. So again, so we have all the information available, but in general, if it happens to us, we need to know what should we do, right? So, and I think as we discussed before, we need to be proactive. And if we see anyone being affected by the stress of COVID-19, talk to people, talk to family, friends, and also talk to the counselors and, if possible, PCPs or the psychiatrist.
Yeah, I guess not being shy or taking the initial step of communication, just talking with
Mhm.
anybody is definitely a benefit for the person suffering from it, or the people around them who have seen people
Right.
or their family members being affected. It's just to consult and take decisive steps. So
Right.
I think we covered a lot of really important topics today, and I'm really glad what you're doing. So
Mhm.
I want to thank you for all your time, and I would like you to again give your information so that people can donate to your organization.
Mhm.
So your organization is Health Foundation Nepal, which
Thank you, Alex.
yeah.
Yeah, it's Health Foundation Nepal. So briefly we call HFN, and the website is www.healthfoundationnepal.org. And you can also find us in Twitter and Instagram and Facebook. You can just search Health Foundation Nepal. You can find that. And so if you have any questions, you can email me. There is the email, which is the Health Foundation Nepal at gmail.com. It's pretty simple. All the Health Foundation Nepal at gmail.com, and that will come to one of us, and we'll respond to you. And again, this is not only my project, my team's project, or Health Foundation Nepal's project. This is the project of all of us, all the Nepalese people who care about Nepal, especially the health care services, whether it's mental health versus general physical health in rural Nepal, where people are living without any resources. So, and we can do it together if we kind of support each other, and we can make significant impact in the people's life in rural Nepal.
That's amazing, and thank you so much for whatever you're doing. And hopefully, your organization and your works will expand and be able to touch lives of a lot of people. And I want to thank you so much for your time.
Thank you so much, Aras. Thank you.